Okay, students, good morning to all of you. We are going to study cardiac profile test. Here we know that why do we perform this cardiac profile test? What are the tests we included in the cardiac profile? So let's start with the introduction here. This cardiac profile test measures the level of cardiac markers in patient blood. What is cardiac marker here? Cardiac marker is any substance, okay, which are released from the muscles, okay, during the cardiac muscle damage. So they are considered as a cardiac biomarkers, and those substances which are released in the blood. Now if you are able to measure that certain biomarker, then we can be able to detect the level of uh, this the substances in the blood, okay. And after that we can measure that what is the uh, extent, what is the severity of the damage in the heart muscles, okay. So here we study about that uh, the cardiac biomarkers which we can measure in the blood, and this is the one of the methods of identifying heart function. So if you do cardiac profile test, so this test is one of the method of identifying that if the heart is functioning normally or abnormally. And there are some medical tests which are available to diagnose the heart condition, which is either normal or abnormal. So these are the a series of medical tests. The first is the blood test we can go through, okay, where we can analyze cardiac biomarkers, and then there are so many other tests out there apart from the blood test, like ECG, electrocardiogram, exercise stress test, echocardiogram, which is ultrasound, then nuclear cardiac stress test, coronary angiogram, magnetic resonance imaging (MRI), and we do coronary computed tomography angiogram, which is CCTA. So they are the series of medical tests which are available. And here in the medical laboratory, basically in the pathology laboratory, where we can do the blood test, and we can do we can perform some cardiac biomarker test. Why do we do blood test in heart attack? This is the one of the one of the questions that if there is a heart attack, why do we do blood test? So here we need to understand that in heart attack, the cardiac muscle is damaged, right? When the cardiac muscle is damaged, then this releases heart specific substances in the blood, and we call it as a uh, cardiac biomarker, okay. This heart specific substances, when they release in the blood, then the blood test can measure the substances and then can show how much heart muscle has been damaged, okay. So this is the what the cardiac profile test we do, okay, in the blood, and this will help us to know that how much heart muscle has been damaged during the heart attack. What tests show blockage in heart? There is a blockage in the artery of the heart, so one of which test is suitable and can suggest the blockage in the heart, and this is the most accurate method to detect blocked arteries in is called cardiac angiography, which is an invasive test and which requires a catheter to be threaded into heart vessels, okay. So the blood vessels is inserted with the catheter, and through which we can be able to detect if there is some blockage in the artery, and the test that is known as a cardiac angiography. This is a most accurate method, okay, which gives you idea that if there is blockage in the heart. Ischemic heart disease, let's know about this. This is the one heart disease which occurs because of ischemia. Ischemia is a medical term which describes that inadequate blood supply to the heart, or inadequate blood supply to some tissues or organs. Okay, so here ischemic heart disease is a disease where there is a inadequate blood supply to the heart muscles. And here one of the artery is a coronary artery. So coronary artery, here coronary blood supply to the myocardium is inadequate as compared to its demand. So what we understand here, the myocardium, the muscles of the heart, get inadequate blood supply as per compared to its demand. And this is the coronary artery, what it supplies blood to the heart muscles. So there are some causes of this ischemic heart disease. The most common cause is atherosclerosis, which is the deposition of cholesterol and fats in the arteries. Second cause is a congenital anomalies of the coronary arteries. Some by birth there is a defect in the coronary arteries. Because of that, it leads to inadequate blood supply to the heart muscles. Here, coronary emboli of various nature from different sources can also lead to inadequate blood supply to the myocardium. What is a coronary emboli? It's a kind of blood clot, okay, which can occlude, which can stop the blood supply when it comes within the lumen of the arteries, right? And the emboli may come from the different sources, may from the different blood vessels, okay, and can be because of a result of the bacterial endocarditis, which is an inflammation of endocardium, okay, because of the infection. And there is a atheromatous plaque, which is the atherosclerosis mechanism, where the fat and cholesterols are deposited, and we call the deposit as a plaque. And finally, there is a diminished blood supply, where the blood supply is not adequate. The blood supply is decreased. So this is the reason of coronary ischemic heart disease. The fourth one, what we say, severe anemia, carbon dioxide poisoning, and decreased oxygen supply to myocardium. This is also one of the reason of coronary emboli, which leads to this can lead to the coronary emboli here.
I'm gonna put my video on when I'm not wearing a shirt.
Yeah. So ischemic heart disease clinical manifestation here. This is the first manifestation we see in the patient suffering for ischemic heart disease. That is called as the arrhythmias, which means irregular heartbeat. Second, it's the angina pectoris, which is a kind of chest pain. So it's a clinical syndrome. There is a group of signs and symptoms, and this results because of sudden attack of chest pain of short duration. So this is the called as a angina pectoris. Okay, there is some mistake here. Let me correct it. So we studied about the clinical manifestation that is seen during the ischemic heart disease. One is the arrhythmias, which is irregular heartbeat. Second is angina pectoris, which is just kind of chest pain, right? So sudden attack of chest pain of short duration. The chest pain is of sometimes sudden and it's a short duration, and it shows a group of syndrome like a pain in the chest region, pain in the when it causes irregular heartbeat, right? So this is the clinical manifestation which can be seen during the ischemic heart disease. Now, coronary atheroma, which is a thickening of the coronary artery, which occurs because of lipid deposits within the intimal port of coronary artery. So, inner lining of coronary artery, there is a liquid deposit. This leads to narrowing of the blood vessel lumen. So, lumen becomes narrow. This artery's lumen become narrow, and then after that, this leads to diminished blood supply to myocardium and myocardium. Okay. So myocardium is the muscle of the heart. So there is a blood supply which is decreased, and there may be the formation of thrombus in the coronary arteries. So if there is a formation of thrombus in coronary arteries, so it causes complete occlusion, and the complete occlusion causes finally infarction or heart attack. So this is the image which shows that how it happens. That this is the lumen of the arteries which has undergone atherosclerosis process. You can see this is the yellow part which is called as a plaque, where the fat and cholesterol has deposit in the arteries. This is the muscle layer, smooth muscle layer. This is the lumen, This is the plaque which has abnormally formed within the between the smooth muscle and then endothelium lining of the vessels. So here, this can damage to epithelium. This endothelial lining can be damaged. You can see the damage of endothelial lining. When the endothelial lining is damaged, so it leads to trigger the activation of platelets. The platelets are activated, and this leads to the clot or fibrin deposit on the plaque, forming a clot. So the fibrin is deposited on the plaque, and it causes clot formation here. So moderate narrowing of lumen. You can see this blood vessel is moderately narrowed. So this is mild cases. This is moderate cases where we can say the all the periphery of the lumen has plaque formation. This is the partial plaque formation. This is the the periphery plaque formation. Okay, and this is moderately there is a lumen of the narrowing of the lumen, and here this image you can see that thrombus partially occluding the lumen. So here the thrombus can also can be formed, and which can occlude the block of the lumen. And here this is the partially occlusion process. The small still there is a small narrow lumen which allows the passing of the blood. And here we can see the complete occlusion process. There are complete blockage of the lumen because of the thrombus. So this one is a partial blockage, this one is a complete blockage. And after this, when there is a complete blockage, this leads to ischemia, that is a loss of blood supply, and this leads to cell death and what we say infarction, and we call it as a heart attack here, right? So this is what changes takes place in the person suffering from ischemic heart disease. These are the complications takes place because of the atherosclerosis mechanism. So cardiac disease, which are modifiable risk factors are there. We can some risk factor which can be modified in the patient who are having the cardiac disease. Okay. So what are the modifiable risk factors? So hyperlipidemia. If a patient has a hyperlipidemia, in this hyperlipidemia can be normalized by doing some physical activities, or by the medication process, or maybe by the response of nutrition, which can be tightly regulated. Diabetes mellitus.
He went home. It's fine. No one got
Yes,
to see the mics.
Martin, can you mute yourself? Okay, diabetes mellitus is also the modifiable risk factor, because if there is diabetes mellitus, this leads to uncontrolled diabetes mellitus leads to cardiac disease. So if someone is having cardiac diabetes mellitus, so this can be managed, this can be modified, it can be treated, and we can prevent the cardiac disease. Smoking, yes, we can quit the smoking habits, and we can prevent the cardiac disease. Hypertension, if there is a high blood pressure, so this can also be normalized by medication, and we can prevent the cardiac disease. Stress can be modified. We can change the lifestyle. We can try to become happy. Obesity is another of the factor which can be also be modified. If a person is obese or obesity is there, then we can normalize by changing the lifestyle, changing the nutritional behavior, changing the physical activity. Okay, and then heavy physical activity. So this is the what these all are the risk factor which can can be modified, and we can prevent the cardiac disease. Diet high content of saturated fat and cholesterol, so this can also increase the cardiac disease. Now, non-modifiable risk factor which cannot be modified, we cannot change it, but there is a high risk of cardiac disease because of this factor. Like heredity is a non-modifiable, you cannot change the genes or DNA. So individual more susceptible to premature atherosclerosis can have can get the cardiac disease. So if there is a hereditary condition, if someone is suffering from atherosclerosis in a parental side or maternal side, so this is one of the factor which cannot be modified actually, but we can change the lifestyle. We can try to take the precaution measures, and we can prevent cardiac disease. Age, after middle age increases the incidence of atherosclerosis. So age cannot be modified. Everyone goes in the middle age also of their lifespan. So the incidence of this atherosclerosis starts from the middle age, and here precaution may be taken when the person is at the age of the middle age of the lifespan. And the sex, basically male is more prone to atherosclerosis than the woman. So male has more risk in compared to women. And here we can suggest the male to take more precaution, more prevention measures can be taken by the male, so that we can prevent the atherosclerosis process. Here, classification of cardiac profile test we are going to know. Cardiac profile test, there are three group of cardiac profile test. Group 1, which is for screening of diabetes mellitus, disturbed carbohydrate metabolism, atherogenic risk factor, and pre-renal condition. So group 1 cardiac profile test can help you to screen these conditions. Group 2, cardiac profile test is help you to assess the risk evaluation test. It's a cardiac risk evaluation test. If someone is at the risk of cardiac disease, so this group 2 cardiac profile test can help the patient. And group 3 is a cardiac injury panel test. Means this group group 3 cardiac profile test helps person to know about if there is an injury in the muscles of the heart. Okay, so cardiac injury panel test comes under the group 3, whereas cardiac risk evaluation test comes under the group 2, and the screening of this condition comes under the group 1. So there are three cardiac profile test, three group of cardiac profile test, and we can see that at what stage we are at what stage the patient is at. If the patient is any patient who are who are going to just check that the heart is normal or not, there is no any symptoms, signs, no history, so just group 1 test can be done. Okay, so if there is a diabetes mellitus, disturbed carbohydrate metabolism, so this can slowly progress into cardiac disease. So then the prevention measures can be taken. Group 2, which will help us to know the cardiac risk, the evaluation of cardiac risk, cardiac disease. So we can do that. Let's know about group 1. Group 1 test, here we do blood glucose test, blood urea nitrogen test, serum creatinine, and serum electrolyte. Okay, so these are 4 tests included in group 1, and which help you to screen like blood glucose for diabetes, blood urea nitrogen for kidney, serum creatinine for kidney, serum electrolyte for kidney. Okay, right. So this is a group 1 which help us to know the carbohydrate metabolism disorder or diabetes mellitus or renal dysfunction. Okay. Group 2, where we do the cardiac risk evaluation test, where we do that if the serum total cholesterol is high, then the person is at the high risk of getting cardiac disease. Serum HDL cholesterol, serum total by HDL cholesterol, and then serum VLDL and LDL cholesterol, serum triglyceride. So these are the group of tests which are included in group 2, and this test helps us to know the risk of cardiac disease. So this is a risk evaluation test, that a person is at the risk of getting cardiac disease or not. Now, group cardiac profile test, which are group 3 type. So here we do serum creatine phosphokinase (CPK), we do the ACPT, we do LDH, we do SSBD. So these are the tests which help us to know actually that the injury, the extent of injury or damage which has occurred to the muscles during the heart attack. Okay, so this test is helpful in assessment of injury during the heart attack. But we said that group 3 is a cardiac injury panel test, and this test assess severity of heart disease, and to follow trend of the disease, that like the disease that which is mild, moderate, or severe. Okay, and then determine post-operative disease, like if there is a operation, okay, surgery. So we can do the cardiac injury panel test. Okay, So we can do the prognostic condition. We need to determine. We need to go through the group third cardiac profile test, and ECG can be done, which do not permit clear diagnosis actually. But 20% infarct are silent. What we know that 20% of the infarcts or blockage are silent, and this ECG cannot give you the clear diagnosis. Basically, in the elderly diabetes mellitus or hypertension patient. So CPK, LDS, SGOT, SSBT levels in serum can be done. This test can be done, and these are for the diagnosis and prognosis of the heart disease. And the concentration of CPK, LDS, SGOT, and SSBT is directly proportional to the size of infarct. So if the size of infarction is bigger, then the concentration of these enzymes are also higher. So this is what we have understand today. We have come to the end of the slide. We have studied cardiac profile test, where we studied different types of cardiac profile test, which are group 1, group 2, group 3. We studied about the ischemic heart disease, and here we studied about how this ischemic heart disease takes place. Okay, and now let's come to the questions discussion, where we can discuss some of the any doubts are there. So let's discuss the doubt. Yes, time for discussion now.